I am Lakshman Mudliar, also from Fiji, Sharina's husband. Last year, in around November to December, uh, she went to see her GP. She was, after menopause, she was having a bleeding, and she thought because of menopause, she was having that bleeding. But when she went to the GP, her GP referred her to her gynecologist. And the gynecologist uh, then did the normal procedure of taking some tests and some samples were taken for biopsy and sent to Australia for analysis. That took 6 weeks. And in the meantime, we didn't know what was really happening. When the results came, she was diagnosed for cancer. Luckily, one of our friends from Pacific Medical Facility assisted us in terms of getting some codes here and gave us some confidence that India could treat her with this particular disease. And then dropped us at the airport the early hours of the morning, from the airport to the hotel in the early hours of the morning. The following day, uh, doctors were organized. We came to see respective doctors, Dr. Minu Walia and Dr. Reshmi.
Mrs. Sharina Devi, a resident of Fiji. She came to us, and when we investigated, we found that she had not a very early stage cervical cancer. So, something which is quite a complicated case. It was a locally advanced, cancer of the cervix. Now, had it been an early stage cancer of the cervix, we would have thought of surgery. But in cases like this, which are locally advanced cancer of the cervix, to give the best treatment, we need to have a combination of radiation therapy and chemotherapy.
We are satisfied that the treatment that they have provided so far has been good. Hospital staff have been treating us reasonably well. The logistics provided by Shivam and team had been good despite few sessions of us having to wait to see the doctors. Maybe that is one of the areas that could be improved upon.
We treated her initially with external beam radiation therapy along with concurrent chemotherapy. External beam radiation is around 5 weeks, followed by 3 sessions of internal radiation in the form of intracavitary radiation therapy. Now she has completed the treatment and she is going back to her country.
After my treatment, after this 2.5 months of my treatment, I feel confident that I think I should be cured. Yeah. I would like to thank Dr. Minu Walia and her team, together with Dr. Shukla and her team, for their treatment.
So we have different types of radiation therapy, something which is known as external beam, and then there is something called as intracavitary radiation therapy. You give boost of local therapy to increase the tumor kill, to enhance better results, and that is what we had resorted to in her case also.